Happy Wednesday morning, everybody. Today's topic is kind of interesting. Have you noticed that suddenly everybody that we know or everybody who comes to my clinic is either on Wegovy, Mounjaro, Ozempic, or Zepbound? And suddenly it seems like everybody we know is on it. And the question generally is, Dr. Isan, are these weight loss drugs? Are these diabetic drugs? Which one's the strongest? Because I really want to get the best for the amount of money I'm paying. Do I have to stay on this forever? And you wouldn't expect this from an oncologist, but everybody keeps asking me, so I had to put on my internal medicine hat and help out a little bit. I've had patients of mine that are on it and are doing really well ask me, could these medicines someday have a role in cancer prevention or even in cancer treatment? And so the last question I jotted down yesterday before I left the clinic was precisely why I became so interested in this was there is truly some fascinating, how would I say this, science and research going on that's going to make a world of difference over the next few years. But let me make something very clear from the beginning. Why is that important? Is that these medications are not currently cancer treatments. I want you to remember that. If you're studying the relationship with cancer, particularly cancers that are related to obesity and metabolism, that's important to remember. So today, let's separate the science from the hype. I have family members, I have patients, I have friends. I've been told that I should try some of these medicines because it may help me eat less sugar, I guess. Um, what exactly is a GLP-1 drug? I want you to understand this from an internal medicine point of view, which is what I went to school for. GLP is actually a hormone that your own intestine normally makes after you eat. Think of it as your own natural "I've eaten enough" signal. And so these medications help us stop eating. They also are amazing because they help your pancreas. We've talked about pancreatic cancer before. They help your pancreas control sugar and they reduce hunger. Uh, they help you feel full sooner, and ultimately, uh, the movement of food through our gastrointestinal system and ultimately stomach and further down slows down when you start doing these injections. So that's definitely something that's a big part of this. And what's kind of been a question that comes up often is that this lack of interest in food in patients that used to be more interested in food. And so now let's clear up the names a little bit before we go on because I like to be a physician and it almost confuses people. So Ozempic and Wegovy, the same medication is semaglutide. It's SEM. Ozempic is primarily marketed for type 2 diabetes. Wegovy or semaglutide brand used for chronic weight management. So that's just a distinction, and I would write all this out so you have it. Um, then what do we have? Mounjaro, we have Zepbound, and these are called Tirzepatide, which basically is a group of drugs that kind of helps us separate them. Now, Mounjaro is primarily for diabetes, and it's primarily branded for diabetes. Zepbound is a weight loss management drug, and tri- Tirzepatide is slightly different, particularly because it works two hormonal pathways. One is our GLP-1, and the other one is our GIP system. Now, rather than GLP-1 alone having affected two different pathways, it becomes more of a useful drug because now it's kind of killing two birds with one stone, which is what I always say. And yes, in a head to head obesity trial, Tirzepatide produced greater average weight loss than semaglutide, but that does not mean everybody should automatically take Zepbound. The best medication depends on the best person. So, the next question everybody asks, how much weight can you actually lose? That's so common. The answer is sometimes a lot. And these are not the old fashioned weight loss medications many of us remember. I remember the days of fen-phen, where everybody would lose weight, they'd be angry all the time, and then they'll have pulmonary issues. In major studies, some patients lost well into double digits as a percentage of their starting body weight, and that's a big deal. With higher dose tirzepatide, average weight loss in one major study approached roughly 20%, and that's a lot of weight. So that's why these drugs have changed the conversation around obesity. Obesity is not simply a matter of someone needing more willpower. The brain, the intestine, the pancreas, the hormones, and metabolism are all communicating with each other. And luckily, these medications change some of those signals, which is wonderful. What are the most common side effects? Typically, is people feel unusually full. That's the purpose. Mostly have issues with nausea, constipation, and I've had patients get diarrhea. I've had patients who have had vomiting, indigestion, heartburn, reflux. And that's really also why usually doctors like to start low dose on every one of these injections and gradually move up. Um, I really think if you go up too quickly, from what I've seen from all my patients that are already on it by other physicians who've given it to them, is that they're quite miserable after they take it. Now, a very important question, can you lose muscle while you're losing weight? The answer is yes. When people lose substantial amount of weight, some of that weight can be lean tissue. So I don't like that, not just fat. So that matters tremendously, especially as we get older. Yours truly, 53. It matters even more. And as an oncologist, I absolutely do not want my cancer patients becoming frail um, or losing muscle mass unnecessarily. So, if someone is using one of these drugs, nutrition matters, adequate protein matters, and resistance exercises is really important. Resistance means you're doing something heavy, you're lifting, you're going to the gym and you're picking up things with band, or you're doing the band exercises. The goal truly shouldn't simply be make the number on the scale low, even though we all have scales. I have one in my clinic. So the beauty of these medicines is that it does improve health while it protects strength if you do it right. Another common question is stopping Ozempic or Zepbound. Uh, what happens? Does all the weight come back? Yeah, it can. It really can. These medications don't permanently cause the biological signal that contributed to obesity to begin with to keep on being there. So when treatment stops, appetite returns, And studies have shown that patients regain the weight they lost and sometimes more. For many people, obesity needs to be thought of more a high blood pressure type of a problem or diabetes rather than I'm going to lose weight and I'll be thin and not have problems with obesity ever again. Now, the scary question: do GLP-1 medications cause cancer? I get that asked too. And you may have seen thyroid cancer warnings in some of these recent literature I've read. Here's what that actually means. Semaglutide, and again, I'm going to write this out. It's not easy to remember. Semaglutide, Tirzepatide carry a warning about thyroid C cell tumors because these tumors occurred in laboratory animals. And always that's how medicine starts. We do not know what these medicines cause, and ultimately, we do not know that these medications cause medullary thyroid cancer in humans because of the thyroid C tumors. However, people with a personal or a family history of medullary thyroid carcinoma or a genetic syndrome type called MEN, like men, women, MEN type 2, generally should not take these medications. That I can tell you as an oncologist. Now, that's very different from saying Ozempic causes thyroid cancer. I just gave you a disclaimer. It's much more, it's really much more than that. And now we arrive at the question that really interests me. Could GLP-1 drugs actually lower the risk of some cancers? Yay, maybe. But we're not ready to say that yet. Obesity is associated with increased risk of multiple cancers. So logically, improving obesity and metabolic health might influence cancer risk. And in several, and I'm quoting this, large observational studies have reported reduction in certain obesity associated cancers among people that are taking the GLP-1 medicine. And researchers are even studying the possible effects beyond weight loss. That means insulin signaling, inflammation, environmental surrounding the cancer cells, and the changes in that environment that causes the cancer to grow. But remember, association does not prove cause and effect. And that's important, not only in oncology, in life. So losing weight is very different from giving someone a drug that directly kills cancer, which is what I do. At this moment, I would never tell a cancer patient to take Ozempic, Wegovy, Mounjaro, or Zepbound for cancer therapy. I haven't done it, and I'm not doing it until there's science. So we need prospective clinical trials before making that leap. But could this become an important area of oncology in the future? Absolutely. And I'm watching the research closely. It's obviously very interesting to me. Because these medicines have become so popular and there are now unapproved versions of it, which are counterfeits, and they're sold online. I've seen called, some people bring boxes to me of counterfeit Ozempic, so be careful. You don't need counterfeit Ozempic. Please don't buy something advertised as research semaglutide. I've seen that, or research Tirzepatide, or the text miracle GLP-1 from an unknown website. These are real medicines with real side effects. Believe me, I know side effects because of all the chemotherapy I've given for 25 years. Um, so these are real medicines with real side effects and real potential complications and real benefits. But we got to do our homework. So use an FDA approved product when appropriate, prescribed by someone who knows what they're doing. Your medical history and a decent trustable pharmacy that you go to for everything else is very important. So Ozempic and Wegovy then are semaglutide, SEMA. Remember, Ozempic, Wegovy are semaglutide. Mounjaro and Zepbound are Tirzepatide, different family. Sorry, the names are hard. They can dramatically improve diabetes, obesity, metabolic health in appropriately selected patients. They're powerful medicines. They're not magical. They're powerful medicines. They're not magical. Meaning, once you stop them, um, your problems with obesity appear again. So, and today they're not cancer drugs. And the connection between metabolism, obesity, cancer, and how it's very interesting. It really is. So, if that story changes, I'll explain it to you here. You know, I love explaining stuff. My goal is simple: take complicated medicine and make it understandable. Because it takes a lot for me to understand something. I have to read it many times or study it many times. So I always assume everybody else needs that too. Because understanding your health should never require a medical degree. It really shouldn't, especially nowadays with all the internet and everything. So, for what it's worth, this is Alex Eson, hematologist, oncologist, MD, PhD. And next time you ask me if you should take a weight loss medicine, I'm going to make you watch this video. I hope you have a lovely day and happy Wednesday to everybody.